So understanding that, last week we talked about just kind of this aspect of just getting into holiday season. And one of the things I brushed on a little bit, but really didn't go in because I didn't want to obviously mess up the vibe of the episode was just dealing with grief, especially during the holiday season, but just really in general. And I think the conversation of understanding that dealing with grief is such an individualized process. We had Naisha Garza on here who did an amazing job and she's a certified grief counselor, right? And we were talking about dementia, dealing with when your family members get dementia, right? Definitely an episode you should check out. But one thing we talked about is understanding that the aspect of coping with grief is such an individualized experience. It'd be even difficult for me to give you tips and, paths on how to quote unquote get over it. So I want to talk about today on this episode of Medicine Mondays. I just want to talk about this aspect of are you coping with grief, right? Because this is a question that doesn't really get asked out loud. We already understand the thoughts, especially when it comes to men in general, but just in general, when it comes to just mental health and when it comes to dealing with grief, when it comes to kind of this aspect of having to get over things quickly or quicker for everyone else. It's not a conversation that gets had a lot. And sometimes just asking a question is such a lift of a weight off someone's shoulder that they come pouring out, right? I remember I've been when I was doing outpatient medicine, talking to my patients, we're going throughout the conversation, during my exam, and I'm almost done doing what I do. And I just ask hey, is everything okay? And just an open question, is everything okay? And then pausing. And then seeing my patient having to think about it. And they wanted to kind of give everything's fine. They wanted to do that. But when they really thought about it, when they really had the second to really process my question, is everything okay? They realized it wasn't, right? Yes, they were just coming in for a typical, blood pressure check and labs and they were coming in for that. But when they just thought about it with everything kind of going on, it wasn't okay for them. And for them, and it would typically happens, they were kind of the captain of the ship, right? She was the captain of the ship in her household. And, she kind of had to run things, take care of the family, take care of the kids, and obviously take care of work, right? She, doing all of that. And she didn't have time to think about, was everything okay with her? And this was at a time where I knew the anniversary of her mom passing away was coming up. So I just wanted to make sure that she knew that she was in a place that she could talk and be open with. And for her, it was so important because I think our appointment ended up going 20 minutes longer than normal, right? Which again, for me is okay. But for her, it was just doc, I'm not okay, right? And then she just kind of let it out. And she kind of talked about just how she was dealing with kind of the stressors of work and life, family member who had passed away. She kind of talked about all these things. And she said, doc, it's been a long time, but I haven't gotten over it yet, right? And I had to reassure her. I said, hey, I understand. Right? That those things happen, right? The things that happen. But I want you to understand that the feelings that you had, right? You could still have them. In fact, I give you permission to still have them. And I think a lot of times when we're talking about grief, a lot of times people aren't given the permission to still feel the way they feel. One, because it makes others uncomfortable, right? If you've ever experienced, a close friend or family member loss, you understand that it's not a comfortable feeling to think about it, to talk about it. So you want to just kind of go about your day just kind of moving, right? You're just hey, you know what? It happened. Everyone around me seems to be kind of moving. It's good to go. Let me move as well too, right? I talk about a lot. When my father passed away, I was a first year student going to be a second year medical student. So that actually happened during that summer. And thankfully, right? My father, he was one of those ones where he would love to prepare you, right? He said, hey, I ain't gonna be here. Right, forever, right? I'm just saying, I ain't gonna be here forever, right? So it wasn't a shock when he passed away. It was more of oh wow, all right, he was telling the truth. And even as a medical student, I remember having to throw this hat of all right, it's go time. There's affairs that need to be handled, and again, the doctor's son, right, had to handle them. And it wasn't until I remember, I think it was at the wake. It wasn't until the wake where really boom, hit me in the chest, what happened, right? Oh my God, I lost my father, right? And I was just bawling tear and everything. And I remember my wife saying oh my God, that's the first time I've seen you cry. But a lot of times that's what typically happens, right? For a lot of people, right? When we're having to deal with grief, when we're having to deal with loss, we're having to kind of process things outside of it, and then the grief happens to be kind of this secondary thing that occurred. I think a lot of times for a lot of friends and family members who are on the outside looking in, they don't know like how it's hitting you. They don't know how it's affecting you, right? Like there's different stages of grief, right? Denial, anger, bargaining, depression, acceptance, right? So there's different stages of grief that occur. And a lot of times people want you to kind of move through these stages quickly, right? Or move through them in 1 month or in 2 months or 3 months or whatever arbitrary time that they feel you should be moving. And for a lot of people, right? Like they just don't jive with that, right? Like, again, I definitely highly suggest you check our episode with Naisha Garza. Just follow her in general. She's an amazing person, just talking about this aspect of grief and understanding grief and loss. Kind of sometimes we'll go kind of hand in hand, but some people can have grief without having kind of loss. And that's why I really wanted to talk about the dementia, right? Because, your family member like hasn't passed away, but the person you knew has. Right, which is tough, right? You're looking at a body, you're looking at a shell of a person you used to know, but it's not the person that you used to know. So the physical body hasn't been lost, but the mental aspect of it has been lost, right? And then there's some people who just lose, right? You lose a family member who passes away either early or late, or whenever they pass away, they just pass away. And there's no books out there, right, that says like, what's the appropriate time that we should be getting over things, right? And we have to understand that for a lot of people, getting over things are gonna happen in different ways. We talk a lot, I talk a lot, especially with my show and just my platform, when I talk about men, right? Understanding that men process just the things that they process so differently, right? That a lot of times, because they're under the burden of toxic masculinity, they don't understand like, all right, like how do I get this grief off? How do I get this anxiety off me? How do I get this depression off me? They don't understand how these things kind of go, right? So they lash out in aggressive behavior, or they're completely standoffish, or like they shut everyone out. They don't really have ways to communicate or talk, and because it's never been talked to them, or they've never even been given the space to do so. Right. And a lot of times they're usually not given the space to do so by their friends, right? By other men, right? Which is a whole different conversation there. But it is one of these things where understanding that there are systems in place to help assist you, right? Whether it be talking with, a good support system like a friend or family member, or if you have access to, talking with a counselor, like there's certain systems, there's certain processes, there's certain ways that we can kind of help people move through all of these stages. But understanding that that way may not be a one size fit all, understanding that that way may not be, like, all right, I'm going to go from point A, point B, like that may not be the route for you, but understand that there is a route, because I do caution the people who live in the grief, right? And when I say live in the grief in a sense where they can't function, right? They can't move forward. They can't process, right? Because no one is saying that the act of moving forward means I'm done with the grief. And that's why I love Naisha. She came on the show and talked about that. Like, we're not talking about this aspect of because, I move forward, that means the grief is done. Like, no, that's not the case whatsoever. It's that I can move forward recognizing that I may be a different person after this. And that's okay too, right? It's okay to be a different person while coping with the grief, learning how to live with the grief, learning how to move around now, because I can't move around the same, right? Like, am I the same person I was before my father passed away? No, right? I had to be a different person. I had to be a new person for my little brother, for my little sister, for my mom, my step. I had to be a different person, right? Because all of a sudden, right, the heap of responsibility was placed on me. I want us to understand that coping with the grief isn't a death sentence. Like, it is something that we are allowed to move forward with. It is something that we are allowed to have live with us. And it is something that, we're allowed to not have a shot clock, right? Like, the shot clock can be turned off when it comes time to grief. The grief can be seasonal, right? Like, I can be good for 8 months, 9 months. And when it gets around that time, it hit me again. I may be off my game, quote unquote, for a couple months, but I'm back. I'll be back come, in a month or so, right? Or a week. You're allowed to do that as well too. There isn't a one-size-fit-all playbook in asking and dealing with the coping of grief. I do wanted to make this episode, right? Because I wanted it to make it okay to ask, hey, are you coping with grief? And if you are you doing a good job? Because that's the most important thing, right? Like, if you're coping with it and you're living with it and you're moving forward with it, we're going in the right direction. But if it's debilitating, if it's handicapping, if it's making it so that you can't do the things you need to do, right? This is when I think you need some help. right? And we'll definitely put some information in the show notes on just kind of national organizations, especially if you need access to counseling. Like, so we'll put Naisha's information on there as well too. She's a CEO of Daniels Harbor. She does like online grief counseling as well too. So I think that especially for those who may, need a counselor or just need someone to talk to, they don't have to be in your local area, right? We can do it like just like how you're watching me or listening to me, right? We can do it virtual, and so to speak, right? So, but I always suggest understanding, having a game plan when we do these things. I don't want the grief to succumb, right? I want us to be able to cope with it, live with it, and move forward with it. I'm yours truly, Dr. Barry Pierre, and I'm gonna see you next week.